Postoperative care after soft tissue regeneration surgery is very important, and unnecessary pain and complications can be minimized if instructions are followed carefully. Today, please wait to eat until your numbness has worn off. This should take about 2 hours, but varies widely in between patients. For a period of 6 weeks, chew away from the grafted area and stay on a soft diet, avoiding anything hard or crunchy that may either put too much pressure on the grafted area or may get wedged into the surgical site, such as popcorn, cereal, nuts, or seeds. Your diet does not have to be liquid, but it needs to be soft. You can eat fish, pasta, soft-cooked vegetables, potatoes, or anything which will not put too much pressure on the graft or get stuck in an incision. Please avoid anything overly hot, citric juices, carbonated beverages, or acidic foods such as tomatoes. It is crucially important for the success of your procedure that the area can heal undisturbed for at least the first 6 weeks. You should brush and floss the areas not worked on today, as you usually would using your electric toothbrush, floss, and a tongue cleaner. However, the grafted area should be left alone entirely for the first week. After 1 week, start brushing the area where the graft was placed carefully using the soft bristle toothbrush we're giving you today. Please do not floss the grafted area for 6 weeks. After 6 weeks, you may go back to your normal routine using an electric toothbrush and floss also in the area where the graft was placed. If I prescribed a Paradex rinse, you should begin rinsing tomorrow 2 to 3 times a day for 1 week. Paradex is an antiseptic and will help keeping the surgical area clean. Please do not rinse until tomorrow, and do not use Paradex for longer than 1 week. For at least the first 6 weeks, do not use a water pick around the graft. If you feel that something is stuck in the surgical area, please try to remove it carefully using a Q-tip or floss. Please do not try to look at the grafted area for at least 1 week, since pulling away your lip can pull away the grafted tissue and cause the graft to fail. Use caution when washing your face and avoid touching the area with your tongue. Do not touch the grafted area with your hands, as this may carry bacteria to the site and potentially could cause an infection. Discomfort after soft tissue regeneration surgeries can usually be managed with over-the-counter pain medication. Please take 3 pills of ibuprofen, such as Motrin or Advil, plus 1 tablet of Tylenol extra strength, 3 times a day for 5 days. Now that's a total of 600 milligrams of ibuprofen plus 500 milligrams of acetaminophen 3 times a day for 5 days. If you cannot take ibuprofen, take 1 tablet of Aleve, which contains 220 milligrams of naproxen 3 times a day instead. If your doctor has advised you to neither take ibuprofen nor naproxen because of a stomach ulcer or anticoagulation therapy, we will give you a prescription for Celebrex 200. Please take 2 tablets of Celebrex as soon as the procedure is completed. Afterwards, take 1 tablet twice a day for 3 days. Do not take Celebrex for longer than 3 days. For severe pain, take the narcotic pain medication I may have prescribed for you instead of Tylenol. The narcotic pain medicine will make you groggy and will slow you down. Do not drive or work around machinery, and do not drink any alcohol while being on narcotic pain medications. The narcotic may contain acetaminophen or Tylenol. Please remember to not take any other Tylenol so you don't exceed the daily maximum dosage of 3,000 milligrams of acetaminophen, which is a total of 6 tablets of Tylenol, extra strength, in a 24-hour period. Discomfort usually peaks at 3 to 5 days and should get substantially better after that. If you experience increasing pain after 3 to 5 days, you may have developed an infection. Other than increasing discomfort, you may also experience more swelling or a foul taste or smell. Please give me a call if this is the case. Stiffness or tenderness of the jaw muscles may cause difficulty in opening your mouth for a few days following the surgery, especially if the procedure was complicated or if you're suffering from a temporomandibular disorder. This is a normal postoperative event which will resolve on its own within a few days. If we gave you a palatal bandage, please wear the appliance all the time for the first 2 weeks. Only remove the appliance twice a day when you brush your teeth. Please clean the appliance using a manual toothbrush and toothpaste every time you brush your teeth. Antibiotics are important after soft tissue regeneration to prevent an infection. If you're not allergic to penicillin, please take amoxicillin 500 3 times a day for 7 days. If you're allergic to penicillin, we will give you a prescription for a Z-Pak, which contains 6 tablets of azithromycin 250. Please take 2 tablets the first day, followed by 1 tablet daily for 4 days. If we prescribed another antibiotic, please take it as recommended on the instructions. Please finish the whole bottle except you develop a rash or any other signs of an allergic reaction. If you do, immediately stop taking the antibiotic and give me a call. Diarrhea is a common side effect while taking antibiotics and can be improved by taking over-the-counter probiotics at the same time. You can find those in any pharmacy. If you develop severe diarrhea, please stop taking the antibiotic and give me a call. To minimize bleeding, sleep with your head elevated and avoid heavy exercise such as running or lifting weights for at least 1 week. You can start light exercise such as brisk walking, swimming, or mowing your lawn during the 2nd week. After 2 weeks, you should be able to exercise normally again. A certain amount of bleeding is to be expected following soft tissue regeneration surgery and usually stops on its own. If bleeding does not stop, take one of those sterile pads of gauze we're giving you today, make it moist under clean water, and firmly apply pressure to the area of bleeding for 15 minutes. Make sure that you clean your hands well before touching the pads so you don't transfer any bacteria to the surgical site and potentially cause an infection. If you run out of gauze, use a tea bag instead. Tannic acid in tea bags helps to form a clot. If bleeding does not subside, call me for further instructions. Postoperative swelling is usually proportional to the surgery involved and is the body's normal reaction to tissue repair. Swelling will not be visible until the day following the surgery and will usually peak at 3 to 5 days. If you had soft tissue regeneration on your upper front teeth, it may look a little scary for a few days since this area of the mouth is more prone to develop postoperative edema. But please don't worry, this is a normal and necessary part of wound healing. Please apply an ice pack or a bag of frozen peas to the side of your face where you had the graft placed. Ice should be applied 10 minutes on and 10 minutes off for the first day. Make sure that you never apply ice directly to your skin to avoid frostbite. After 24 hours, ice has no beneficial effect and you should stop using it. If I prescribed a Medrol dose pack for you, please make sure that you start taking the medication as soon as possible after the surgery, as this will further help to reduce swelling. Bruising is normal after soft tissue regeneration surgery and usually develops 2 to 3 days after the procedure. If you had soft tissue regeneration on your upper front teeth, you may also develop a black eye. Bruises often start as black, blue, or purple discolorations of the face and turn green or yellow as time goes on. Gravity makes them travel down your neck and chest until they usually disappear after about 7 to 10 days. Moist heat applied to the area can help to speed up the process. Complication rates triple with smoking. Therefore, smoking is absolutely prohibited for at least the first 2 weeks after the procedure. Several of my patients were able to quit smoking after a dental surgery I provided for them, and I'm sure you can do the same. This is a perfect time to quit. Sutures sometimes become loose, and this is no cause for alarm. Just remove the suture from your mouth and throw it away. Depending on the suture material I use today, they will dissolve within a period of 1 to 6 weeks. Now with that, thank you for choosing our office and for trusting me and my team. Please feel free to call the office or my cell phone if you have any questions or concerns. It is never a bother. My cell phone number is on the post-op instructions we're giving you today. If I can't pick up, just leave me a message and I'll promise I'll call you back as soon as I can.